And like Dr. Shamie said, even though I said I had LASIK, I actually went in wanting PRK because I'd been doing martial arts since I was 7 years old. And I was always worried about maybe potentially getting poked or punched in the eye. And so PRK was something I really looked at. But for my level of prescription, LASIK actually was the better option. And so most people have heard of LASIK. Some people have heard of PRK, but there's actually a third form of vision correction separate from laser vision correction, separate from refractive lens exchange and cataract surgery. And that's what the EVO ICL is. It's a miniature, micro flexible, biocompatible, crystal clear lens implant that actually gets added to the front part of each eye. So if you imagine a contact lens, it's pretty small, shrunken down to about a third of that size, scrolled up, that's what gets added to the front of the eye through a micro incision. And the reason this technology is really powerful is it can treat a tremendous amount of prescription. So we can treat anyone from around a -3 all the way up to about -16 and up to 4 diopters of astigmatism. So there's some people that come in and their prescription it's just simply too large to have LASIK or PRK done. Or like Dr. Shamie mentioned, maybe their corneas are too thin. Maybe they have a normal amount of prescription, but there's just not enough room in the cornea to safely do the surgery. Or maybe someone has a lot of dry eye, and we worry if someone has LASIK or PRK that that dry eye will get permanently worse. Those are all situations where we can utilize the EVO ICL because we're not using a laser to reshape any part of the cornea. Because of that, it has the lowest chances of causing any dry eye, and it has really a wonderful nighttime vision profile as well. The surgery itself takes about 10 to 12 minutes to do for both eyes. We do both eyes on the same day, and the recovery is much more similar to that of LASIK than to PRK. We say it takes about 24 to 36 hours for the dilation to wear off after surgery, and then after that, patients are seeing really, really well. It's a wonderful form of vision correction. It's a quick postoperative recovery. It can treat almost every type of prescription out there except for farsightedness. So in the United States, EVO ICL can only treat nearsightedness and astigmatism. So if someone has some farsightedness, they're often better suited to have LASIK instead. And like Dr. Shamie mentioned, all of these surgeries, LASIK, PRK, EVO ICL, they can all be done with something that's called monovision. So if someone's at that age where the lens in the eyes started to stiffen up, they're naturally losing their near vision, we can test monovision in clinic beforehand to see if they would like having one eye set for up close and one eye set for distance. And if their brain handles that and they like it, we can do that with EVO ICL just as we can with LASIK and PRK.
If I can add about the EVO
Please.
ICL, I think it's really important when you go in for consultation to go in not saying I'm going in for LASIK consult because as Dr. Hura was saying, yes, LASIK is the most commonly kind of known mode of refractive surgery. But I would really love if you can advocate for yourself and go in for vision correction, choose the right surgeon who has expertise across the different options. Because yes, LASIK is a really great option for many, many patients, but it's not uncommon that we see a patient who, for multiple reasons, again, the most common being dry eyes or corneas that are too thin, or cornea that has a contour that we worry about the potential integrity over time, may not be the best candidate for LASIK. And I find that patients get disappointed when we are offering a better option to them in the form of EVO ICL or PRK, a safer option. I think it's a gift for that patient in that there's multiple options. And our goal is vision correction, safest possible way with the longest, longevity for that patient. And EVO often is that alternative for patients. It's not a second-rate procedure. It is simply another alternative that gets the patient to that endpoint that we really want them to. And it's also now become more mainstream, and there are patients who come in who actually seek EVO over LASIK for the benefits it offers. And that's okay too, because you can be a candidate for multiple options. And it comes down to that conversation of which one sits better with you, which one feels like it would be, with the benefit profiles that it has, which one feels more right to you, even if you're a candidate for all three. And that's what we have mastered in our practice and really guiding the patients down towards the right option and the safer option. And in our practice, if anyone has more than a -8 nearsightedness, we tend to recommend EVO ICL over LASIK or PRK. Between -6 and -8, it becomes a more nuanced conversation. And then someone who is less than -6 of nearsightedness, it comes down to other comorbidities and other issues that may make us lean towards one option versus the other. And I think, and then there are always patients who may not be a right candidate for any of the options, and we don't shy away from recommending against surgery if we feel that no option is a good is a better option for the patient.